Good evening, everyone, and welcome to this episode of COVID Care from SCSE. So I'm Pratyusha. I represent Society for Cyberabad Security Council, and I'm the Joint Secretary for the Women's Forum. So on behalf of SCSE and the Cyberabad Police, I would like to welcome all of you all for a wonderful evening for an hour, which is going to be very interesting. The whole objective is SCSC partnered with Cyberabad Police, many organizations to be able to bring about a lot of COVID safety, COVID care in wave one and wave two. So there were a lot of initiatives taken up by SCSC. Mainly the vision for SCSC is around how do we really drive safety of the society to be able to bring about growth in the society. I know there are many people who may be a part either volunteering or being citizens or being traffic volunteers. So there's a lot of work we do around traffic, women's safety, IT security, the infrastructure safety. All of this is something which SCSC collaborates with the police, with the industry to bring about a safe society. Apart from this, unfortunately, fortunately, the pandemic hit us, and we had a lot of citizens who really came forward wanting to help, support in various ways. So that's where we started a lot of webinars, awareness, telemedicine, providing beds, providing oxygens, concentrators, looking at plasma, looking at in the villages, how do we improve the vaccination. So there were a lot of initiatives taken up. And as a part of the same, uh, it's tough, but I think it is not a time to be anxious at all about with the third wave. I think that's where we were very happy to partner with Indian Academy of Pediatrics, Dr. Sri Krishna and his entire team in the Twin Cities, who are going to be with y'all and spending time the next 45 minutes to 1 hour around the whole COVID care and how do we really handle it with real care to be able, whether it's children, whether it's family members, and how do we bring about a better awareness and real genuine information to the people across. So on this note, I'd really like to welcome all of y'all, and we have a guest of honor, DCP Madhapur. So Charan, can we bring DCP ma'am on the screen, please? So let me give you a little introduction about DCP Shilpavalli. She's from Vizag. She's been in the police department for about 9 years. She has worked with the intelligence department later as an admin at Rajakonda before taking charge as a DCP. And I'm very proud to say she's the first woman deputy commissioner of police of Madhapur. Shilpavalli was like, she is really devoted, very ambitious to be able to drive a safer Hyderabad, safer Cyberabad, and really wanting to take forward all her vision and mission statements in driving a safer society as she takes over this new post about a couple of weeks. So Shilpa ma'am, very happy to have you with us, where you are really going to be able to create much more things for the society here. And some few words from you with the experience you had within the waves and how you really are looking forward as a police law and order for the next couple of weeks. So ma'am should be on in a minute, and I think she's coming through. In the interim, I would want to invite and introduce Dr. Sri Krishna. Dr. Sri Krishna, who's really partnered with us. Thanks so much, Dr. Sri Krishna, to you and your team. He's associate professor at Dr. VRK Medical College. He's a secretary for the Indian Academy of Pediatrics Twin Cities branch, consultant pediatrician. He is with consultant pediatrician with Continental Hospitals and Apollo Clinic. And of course, a task force member for the Telangana COVID response. Who other than Sri Krishna can we really bring onto the stage to have an esteemed panelist to partner with SCSC and bring to you the right information, how you can take care of yourselves, your family members, and the children around you. And that's clearly is a topic. We want to make it very engaging. We would like you to post your questions in the last 10 minutes. Hopefully, we will take the questions. But I think Dr. Sri Krishna is already being poured with questions with many people. So I think it should answer most of your apprehensions you have today. So, Dr. Sri Krishna, over to you till DCP ma'am comes in. I think there is a technical glitch where she's trying to log in. If she's not able to, we would like to get started and then we can come back on the other agenda.
Thank you, SCSC. Thank you, Pratyusha, for having us today for a discussion on the current COVID scenario. I request you to please bring on stage Dr. Sunkoch Bhaskar. He's the president of the IAP Twin Cities branch. Would like to invite him for inaugural remarks. Dr. Sunkoch Bhaskar, please, and then we'll take up the session directly after his remarks. Dr. Bhaskar, sir. Sir, you need to unmute.
Yeah. Thank you, Dr. Sri Krishna and Madam Pratyusha. Madam K. Shilpavalli Garu, DCP Madhapur Cyberabad Commissionerate, and the ACSC, the organizers of this wonderful webinar. My co-panelists, Dr. Pawan Reddy, Dr. Nitesh, Dr. Murari Rajendra Prasad, and moderator, my colleague, Dr. R.S.V. Sri Krishna, and all the participants in this webinar. Ladies and gentlemen, wish you all a very healthy and happy new year. And I warm welcome to you all to this very useful and relevant webinar. Interestingly, I took up this position just a week ago, and this year, 2022, our IAP Twin Cities branch executive board action plan, one of the action plans is to have frequent parental awareness programs discussing about their children's health relevant to the issues of their children. All of us were very happy in the month of November, but suddenly this new variant of concern, that is Omicron, has emerged from Botswana, South Africa, and now it's creating havoc across the world. Because this is a highly mutated with more than 50 mutations, and around 30 mutations are there on the spike protein, and remaining around 20 mutations are there on the receptor binding sites, making this Omicron more transmissible, and it spreads very fast from person to person, and it escapes the defense mechanisms of the infected person. Thereby, he'll be very much susceptible to develop the COVID disease. But blessing in disguise is Omicron is causing mild forms of disease, probably thanks to very good seroconversion among the Indian population. All the credit goes to our national corona vaccine program, which had administered 150 crore doses of COVID vaccine as on today, and 2 crore children were vaccinated during the recent past few days. Thanks to the policymakers, governments, and frontline health workers, including the police personnel. We doctors have a special affection and respect for the police personnel because we work peacefully even when we are stressed out with the pandemic like this or in different situations. It's always the police protection which keeps us at peace, and they make us to provide best possible health to the sick children. As I said, this Omicron is going to be a mild form of disease. Don't be panicked. To substantiate it, yesterday there were around 1.94 lakh new cases, that is fresh cases, but deaths were just 442 yesterday. So it shows it's a mild form of disease, except for those who have comorbidities like elderly people associated with other diseases that we will discuss subsequently. So optimistically, this third wave might end by the month of March 2022. So with these hopes, I conclude my inaugural remarks. Once again, thank you SCSC and the police personnel and the police commissionerate for giving us this opportunity to participate in this very useful webinar. Thank you.
Thank you, Dr. Bhaskar. Hand it over to Pratyusha if we can have Ma'am Shilpa on board.
Thanks a lot, Dr. Sri Krishna. And yes, so we were finally able to have DCP Madhapur Shilpavalli ma'am on. So thanks a lot, ma'am, for joining in. I know this is a time where, ma'am, if you can unmute yourself, just want to know if you're audible. Can you hear us? Ma'am, request you to unmute yourself if you can hear us. Yeah. Yeah, that's right. So thanks a
Yeah.
lot, Shilpa ma'am, for being able to join us. I know it's tough times where lots of action has been going on with this third wave. I know we won't take much of your time, but would like you to give your message of the special care you're taking for the team as well as for the society. And over to you, ma'am.
Yeah, thank you, Pratyusha Garu. Thank you, all the panelists and the organizers of this uh, webinar. Good evening to one and all. So, my ideas regarding health are a bit abstract, maybe because I'm not a professional in the medical field. So, I always feel that, nature sets in its own corrective measures to correct things when things are going against the normal course. We all have been rushing through our lives, unmindful of what we are doing, why we are doing, for whom we are doing, and where we are heading to. Uh, Probably that is the one reason why nature has, thrown this challenge at us, made us think the value of lives, value of time, and also rethink the way we look at things. So, in this context, I would like to say, particularly to the children and parents, myself being a parent, I would like to just say that um, children have God gifted immunity during their early ages. But with the kind of junk food we give them, how much addicted we made them to screen, denying them any chance to play outdoors, how we have made them, night owls instead of early birds, again denying them the exposure to sunlight and a healthy lifestyle. So I think inculcating healthy habits right from the childhood matters a lot. We don't sleep early, maybe because of our career issues or various things we have to settle. But at least we have to let them sleep early and wake up early, do some kind of physical activity, pranayama, meditation. Have the sun kiss them. Let the sun kiss them. We are these days afraid of children getting even a bit exposed to sun. We have made them so much used to air conditioned rooms, air conditioned vehicles, air conditioned schools, dining rooms, hotels, wherever we go, whatever we do, they're all enclosed into a air conditioned room. So we are maybe thinking that we are making their lives comfortable or luxurious, but we are denying them the chance to live them close to the nature, accept anything as it comes. Not just for kids, for anyone. To build their immunity, we should have a healthy lifestyle, having healthy food, some proper physical activity, positive thinking, having good thoughts for us and for the ones around us. All this makes a lot of difference. We don't need to change the world. In fact, we cannot also. So let's change ourselves. Let us be the role models for our children. And pertaining to the COVID aspect, it does not begin with this or end with this. Maybe hopefully this third wave is the end of uh, COVID, hopefully, with all the expert doctors and medical advice and the medical services that are being provided by the government, and with all the services given by organizations like SCSC. Thankfully, at least in our department, we could keep the fatality to a minimum, though they are at the higher end of the you know, risk, the amount of exposure they get to the people around them, and the amount of risk they have to face in the context of COVID, still because of all the efforts of the senior officers, still because of the efforts of all of us together, that though we are serving the people, we should be careful enough to see that we should protect ourselves and also protect the public, and also protect our own family members. These were the three aspects where we had to concentrate all our efforts whole during the period of first wave or second wave, and even now during the third wave. So I thank all the organizations who have been supporting us, all the senior officers who have been motivating us, providing us with all the required medical facilities and hospital admissions, and all to all our personnel, all the medical doctors and hospital managements who have been with us, and of course the public. And on this note, I would like to wish all the viewers and all the participants a very happy new year. I wish this year sees the end of COVID, and everyone is back to normalcy. Everyone is back to their not the past life, but at least a new life with all healthy changes in their lifestyle. Thank you. Thank you, Pratusha.
Thanks a lot, ma'am. And I think that was very simple but highly impactful, I would say. And wishing everybody a healthy year. So thanks for your time and your very key message. And I would like to thank Dr. Sunkoch Bhaskar also for his inaugural message. Very positive, very, I must say, simplistic as to trying to remove all the anxiousness which many of us have. So thanks a lot. And in this regard, I'll hand it over to Dr. Sri Krishna and his fellow panelists who are esteemed doctors in the field. I will ask Dr. Sri Krishna to introduce them and we get started for what we are here to be able to take care of ourselves in the third wave and a better, healthy future. Thank you.
Thank you, Pratyusha. Can we have Dr. Pawan and Dr. Rajan Prasad Murari on stage? I introduce Dr. Pawan. He is a senior consultant intensivist and the chief of critical care at Care Hospital, Banjara Hills. Dr. Murari is the state surveillance medical officer on behalf of World Health Organization, WHO. And I also have Dr. Nitesh Agarwal. He is the managing director and a developmental pediatrician at Southern Gem Hospital. And we have Dr. Sunkoch Bhaskar, the president of IIT Twin Cities branch, and MD of Paramita Hospital. So it's a very esteemed panel. I'll quickly take you through what we have for the next 40 minutes. Lot of information that we have, lot of it that comes from media, and that's probably also a cause of concern. And much part of this information is to sensationalize and get it to your attention. What we'll do today is try to look at what science is saying and be very crisp in our questions and answers, and try to address those queries which are there in your mind and perhaps not answered in these multiple media interviews and also what comes in the web. So I'll begin with Dr. Murari. Dr. Murari, you've been with WHO for a long time. What is the current status in the global scenario of COVID across? And most important question that everyone has, why do these variants occur? And how does it actually impact the pandemic, and what is the progress of it?
Yeah. Good evening, Dr. Sri Krishna. Hope I'm audible. Let me know.
Yeah.
Yeah. And good evening, everyone on the dais. So coming to this question asked by Sri Krishna, the global scenario in the last week from 3rd January to 9th January, we have seen the large surge of the cases, especially of these Omicron cases in the globe, which is happening, the surge. We are all aware that Omicron cases are on surge, and almost 15 million cases have been increased in the last week. This is the record increase in number of cases we haven't seen ever in this ongoing pandemic. We know very well Omicron is highly infectious and it transmits very fast from person to person, and this is the reason why we have seen the huge number of cases in this ongoing pandemic with Omicron variant. So coming to previous week, we have seen only up to 8 or 10 million cases per week. And this last week, there are a huge number of increase in number of cases, almost more than 15 million number of cases in the last week from 3rd January to the 9th January. And among these cases, which we have seen in surge, 50% of the cases belongs to Europe country, and 40% belongs to the United States of America, and followed by the West Pacific, and followed by the Asia region. So almost 90% cases belongs to our Europe and USA also, and we are expecting in future in increase in this surge of these cases in our India also. So coming to the deaths, almost 43,000 deaths has been reported in the last week overall in the globe, and these are huge number of deaths even reported. With Omicron, we say it is less severe. It is less severe because it is more accustomed to the upper respiratory tract infection rather than going to the lower respiratory tract infection and causing pneumonitis or pneumonia. It is upper respiratory. It can go up to bronchi and cause bronchitis. So it is less severe, but still the hospitalizations are more, and even the mortality is also more, as we are seeing the huge number of increase in number of cases compared to the other variants of Delta or Alpha and Beta and Gamma. So this case definitely it is showing this Omicron variant is definitely showing the increase in number of cases, and similarly it is leading to increased number of hospitalizations and even sudden surge of these cases and sudden surge of the even deaths also we are seeing in the globe, which is happening currently with this ongoing pandemic. But fortunately, one fortunate thing we observed is in African country there is gross decline in the number of cases. We know it is originated from there, it has peaked there, and now the peak is we are seeing in the United Kingdom, European country, and the USA, but there is gradual decline in Africa. Similarly, we can hope the similar decline in our country, as our colleague partner was mentioning. We may see the decline in this third wave by the end of March. We may hope this, as it is happening in the African country also. And till date, overall, 304 million cases were reported of regarding COVID-19 cases, and 5.4 million deaths have been notified to the WHO till date globally. And there may be decline in the access to the tests diagnostics, as there is a sudden huge surge in number of cases, as it is highly transmittable, and there will be definitely overloaded in the hospitalizations, and there may be constituency in the hospitalizations. We may be scared with hospitalization beds, as there will be increase in volume of number of cases. And coming to the variants of concern and variants of interest, we are having two kinds of variants. There are variants of interest, which includes our alpha, beta, gamma, delta, and our lambda, etc. They are only variants of interest because they are not very infectious, or they are not highly transmissible, and they only cause milder infections, and they are only not of concern. That's why we put under them as variants of importance. And then the other part is variants of concern. This includes the Delta variant and our Omicron variant. This Delta variant, we have seen the surge of number of cases in our last second wave, huge number of burden of number of cases, although it is less transmissible than our Omicron variant. Delta variant is more responsible for our second wave. It was more responsible, and we have seen large number of hospitalizations also. In number of deaths also, we have seen huge number of deaths. So this Delta variant, and now Omicron is also added into the variant of concern, and this variant of concern Omicron is also highly transmissible, infectious, and it is spreading very faster in the community. We are seeing sudden surge of the cases, sudden case fatality also we are seeing. It is a highly transmissible variant of concern, Omicron variant. So this leads to overload on the infrastructure available in our state, health infrastructure. So that is the concern. So actually, why do these variants occur? Sri Krishna was asking us. See, this virus, COVID-19 virus, as itself, when it is getting multiplying, during its multiplication, there are many genetic changes in it which occurs in it while its replication, and due to some mistakes which occur in the replication process of this variant, due to that minor changes or minor mistakes which occur, that leads to a new variant. And these new variants we have already classified with the Greek letters alpha, beta, gamma, delta, and Omicron, lambda, etc. So variants of importance and variants of concern we have classified. Variants of importance are just a simple thing which doesn't have huge surge, or which doesn't have the maximum transmissibility or case fatality. And variant of concern, there are two variants, Delta variant, which is the cause of the second wave, and this Omicron variant, which is the cause of the third wave, which is happening on the current ongoing pandemic. Yes, Sri Krishna.
Thank you, Dr. Murari. I'll just take few perspectives here. One, it is like a default nature for the virus to survive, and to survive, it keeps changing itself.
Yeah.
We all know that the organism will have a nucleus and there's a genetic code. Let's say the genetic code is ATS. So as it's multiplying, ATS, this goes on. The more it multiplies, there comes a point where it's not ATS and it becomes ATT. What it does is it's not just at this point. The subsequent points also now get changed. And this happens the more it multiplies. And as it multiplies, it may either go into a variant which is more transmissible, causes more problems, or less. Usually in pandemics, it results in something which is less destructive, and then its survival instinct is such that it is more transmissible and then dies down. How does your personal protection help? If you start wearing a mask and use the mask very diligently, keep it like your spectacles, like your shirt, don't take it off outside your home, then you're stopping the transmission. See the number of times this ATS keeps multiplying. If you are able to, at a personal level, each one of us are able to stop this transmission, then this multiplication stops, and that is when the number of variants start coming down. So Omicron, if you want to stop it from becoming something more severe for your children or for your own family, start wearing the mask. Reduce the transmission. If you reduce transmission, this multiplication stops, and that's how the pandemic will end. We'll talk more about it later. I invite Dr. Pawan to tell us more about the current variant. Dr. Pawan, what you are seeing at Care Hospital in terms of the symptomatology, and also what is the management which Government of India is advising, and is there something more? We have some questions. I'll put them up soon after you finish.
Thank you, Sri Krishna. Thank you, SPSC, for having me here. First of all, there are a few pointers that I would make. People should understand that this is third wave. We are already in the third wave. And unfortunately or fortunately, it has come now. And the point is that there is no need for panic for people to, first of all, because we would read a lot of information that comes in newspapers every day. There is a live, and then there is a news, breaking news coming in. Most importantly, people have to understand that it's a natural progression of the virus to mutate into a different varieties, different mutations keep happening. And it's a natural course, as Dr. Sri Krishna has put in. So whatever that is, we are seeing all sorts of variants. Despite the fact that there is an Omicron, we still see a lot of Delta we are seeing. And we are seeing every February, March, we are seeing a surge of cases in India. That is happening with wave 1, wave 2, and even now. So when we do our testing, we see that there are a lot of Delta still in Hyderabad than actual Omicron. Omicron is not that much in Hyderabad as much as you see. People who have partied in Goa for the New Year, they have all brought Delta in Hyderabad, and people who have partied in Dubai have brought in Omicron. So it is the only thing that I can tell you at this point of time, what we are seeing, patients are all of mild origin. And because you have a huge number, because it's very contagious, it is easily transmissible, it is also causing reinfections in those patients who have already got COVID in the first and second wave. We are seeing them also come with milder symptoms. The most bottom point you have to understand is that at this point of time, it is a mild infection. It is not severe like what we had earlier times. We didn't see exaggerated inflammatory response, people having clots, people having lung problem. We have rarely seen any lung involvement at this point of time. Still, it is in the first week of Hyderabad illness, just we're entering the second wave. Any symptoms or any worsening usually happens in second week in the COVID. So over days, as we see more and more cases, we will see some patients who get admitted, but predominantly almost 95% of them will not have any problem. There is only a few people, few at-risk population who might be admitted because of the huge number of patients that we are seeing, huge number of positives. So there will be some populations because the denominator is huge. You will see more amount of patients. Suddenly there will be a surge of patients who have fever, and then they may have complications, and then they come in. But overall, for the general population, for the general public in per se, you don't need to be too scared about this. This is a milder infection. What we are seeing is patients coming with headache, fever, backaches, body pains, and regular cold, kind of sore throat, dry mouth. But majorly, you will see with fatigue and weakness is the predominant symptom. Some of them will have headache. So usually most of these symptoms are coming down within 3 to 5 days. So it is not going beyond the 5th day. If you have any problem beyond the 5th day, if your symptoms are worsening or persisting, that is when you come to the doctor. Otherwise, you don't need to even seek medical help in majority of the cases if you don't have any underlying risk factors such as comorbidities like diabetes, hypertension, or any other medical ailment. Otherwise, you need to sit at home, isolate yourselves, continue to wear the mask, see that you're not transmitting it. So first thing I would want people to understand at this point, it is still mild, though since the number of cases are going to come. And you have to remember that in this wave, 70 to 80% of Indians are going to get it. There is no escape from it. Even doctors like myself or my whole team, we haven't had any infection for the last 2 years, but even hospitals will have it, nurses will have it. So we are going to have the police people also are going to get it this time more. So there is a problem that workforce will be affected. Our reserves will be tested. More amount of absenteeism with work will be there. So we will have to make sure that things run smoothly despite that fact. The only problem is that majority of them get infected at the same time and they'll go into isolation. There will be a stress on the systems, such as the healthcare system or the police system or the security system. That is what we have to make sure that we don't all get infected at the same time. But unfortunately, most of the country is going to get infected. There is nobody who is going to escape from this. It may be the prime minister, it may be the commissioner, it may be the chief minister. Majority of them are going to get infected this time around.
Pawan, what's the treatment? Whatever government is suggesting, and also there are a few drugs which you have seen. Any specific indication of way to use them?
See, basically, you have to understand that the only thing that will work at this point of time are antivirals, because Omicron, as the number of Omicron strains go up, majority of the treatment modality other than that is you see the monoclonal antibodies and antibody cocktail, which is available, but it won't work for Omicron. So please don't go running for those kind of therapies which are expensive and they don't have any role for Omicron. So don't go and ask for that, don't go running for those things, and majority of the time it is mild. Steroids were a main role in once the patient requires oxygenation. At this point of time, there are very, 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 very few cases who are requiring oxygen with the new wave. Unless and until they require oxygenation or they have lung lesions, you don't need steroids. So it is very important to understand that fact that very few people are going to have that kind of a cascade where steroids will be required. There are few medications such as molnupiravir, which is a new drug. Unfortunately, it has a lot of side effects, though the DCJ has approved it for use based on the studies from the West. The task force, ICMR, and the task force are not including it into the COVID guidelines, and it is not required also, because the effect of it and the way it is going to prevent is not that significant enough to be used. So not much of use with molnupiravir at this point of time. There are some side effects and concerns. That is why even ICMR is not recognizing it as including it in the task force guidelines.
Thank you, Pawan. If I could sum up, so basically the course is over. Let's say 4 phases. So the first phase is when the virus is in the back of your nose and the throat. That's where it starts to multiply. This lasts for the first 3 days, and you get these symptoms, of which the predominant for Omicron is fatigue, weakness, and when you can't get up from the bed. That is probably the major symptom in those who are vaccinated in the current strain. After the first 3 days, your body now puts up a response and you're able to wall off the virus. So it's just that the virus is walled off, but it's not killed as yet. After the 3rd day, your symptoms go away. And day 4, 5, 6, you tend to feel better. But then this virus is behind a wall, multiplying. And at some stage, it's going to burst out. And once this happens, which is on day 7, the 3rd phase, that is when the problems happen. In fact, this is not the problem. The problem is that as the virus is bursting out and then flooding the lungs, it starts to enter two types of cells: the oxygen cells in the lungs and also the blood cells that supply the oxygen, that supply the blood there. Whenever the virus enters these two cells, now the body mounts the second response. This is the cytokine storm. And Dr. Pawan was mentioning how this is the critical moment, wherein after day 5, 6, and the virus spreading down, this is when the damage happens. You've seen in the last wave, second wave, wherein there is a sudden demand for oxygen. Suddenly the patient collapses. That's because first 3 days they had symptoms, 4, 5, 6, the symptoms came down, and day 7, suddenly this flood happened. And now your body tries to attack the oxygen cell and the blood cell. So it causes reduced oxygen, and blood cell, once it is attacked, you form clots. Both of them are dangerous. And this is where much of the damage happens. What we are seeing now is that this second week of illness, second week, this entire mechanism is not happening. And many reasons for that. One, the Omicron variant does not have the same ability to bind to the lung cells as it was with the other variants. Secondly, the vaccine has been successful in preventing the second week complication. Vaccine is not an antivirus. It doesn't stop the virus. It doesn't kill the virus in the community. It only protects you by stopping this second week complications. And to tell us more about how it affects children, I now request Dr. Sankoch Bhaskar to tell us about what are the first presenting symptoms in children. Are there any long-term complications? Because we have understood that the disease is, I won't call it mild, but call it as non-fatal as yet, because we're never sure how our health systems will be stretched to handle it. So this apparently non-fatal variant as now, how does it affect children? What are the symptoms that parents need to be looking at? And what is the long-term impact of the virus affecting the children? Dr. Bhaskar, please. So just unmute yourself. Yeah.
Past second wave, when Delta strain was rampant, we had seen very less number of pediatric cases having COVID-19. That too with mild symptoms, and very quickly to admit the children. Even in Gandhi Hospital, which was the nodal center for this pediatric COVID-19, there were very few admissions, and among those few admissions, there were very few deaths. That too in those children who have associated problems like congenital defects or immunocompromised children, malnutrition, and other associated illnesses. Those children, they were dying, but it was a rare event. Now we are seeing some children, that too, when we suspect the parents having fever, throat discomfort, cough, we are testing the children, and some of them are having COVID-19 positive RT-PCR. But the presentation now is it could be fever with throat discomfort, mild cough, or vomitings and loose motions. But however, to sum it up, my advice to the parents is, please, whenever your child gets fever, if it doesn't subside within 3 days, take the child to your doctor and see that it is not COVID until proved otherwise. So this is my advice. And prognosis is excellent, as I told you. Most of the children, they are asymptomatic. They have an infection, but without any obvious outward symptoms. Even if they have very mild form of symptoms, say fever, some throat congestion, mild cough. And particularly with the Omicron, what the evidence says from the European countries and South Africa is, it doesn't spread down to the lungs and the lower airways. It's only limited to the upper airways, that is running nose, some throat pain, things. So again, my assurance to all the parents is, don't be panic. But if your child is febrile, having fever, you try to manage your child at your home, giving plenty of oral fluids, give him more of liquids, do tepid sponging, that is with warm water. You can give paracetamol after taking the advice from a doctor. If fever persists or if respiratory rate increases, if the brain's appetite decreases, it looks dull, decreased activity, becoming fatigue soon, you'll have to take him to the doctor. And as Dr. Srikrishna asked me, what are the long-term effects? In India, again, long-term effects are not many, but in the month of July, August, we had seen a peculiar condition called MISI, that is multi-system inflammatory syndrome in children, multi-organ system inflammatory syndrome in children, wherein they used to present with, we had witnessed, though we could not admit COVID-19 cases in our hospital, since we didn't have COVID ward, but we had admitted a lot of cases in the month of July and August. That is, after having COVID, 4 to 6 weeks after having COVID, they used to be very well during that period. After 4 to 6 weeks, a good number of children, they used to develop high-grade continuous fever, not remitting, persisting for 3 to 5 days. So those children, they used to get admitted. And when we see them initially, the only presentation is high-grade fever. After then thoroughly evaluating, we could diagnose that it's a multi-system inflammatory syndrome in children. Fortunately, again, many children had come out. Being indoors, a lot of time seeing the screens, doing no physical activity. So they were gaining weight. So obesity was a big problem, and many of them had refractive errors. So these were some of the problems these children had in India. Adolescents had these psychological disorders. That's all.
Thank you, Dr. Bhaskar. And if I can sum it up, see, it's a spectrum, and please do not take it lightly. The pediatric COVID is very mild, and the reason is, imagine you have a door to your house. In adults, there are 10 doors which lead to your house. Children have less ACE2 receptors, so there are only 2 doors. So the amount of virus that actually enters in is very, very less. So it takes a lot of exposure for the child to have the complications or the further disease. But then what they do, they keep the virus in their nose. So they become super spreaders and they spread it to others because their mask usage may not be great and they tend to meet a lot of people in the household and outside. Most of the time it's a mild illness and it will not cause major problems. I would still call it as a not fatal condition. But you have the other end of spectrum, which Dr. Bhaskar said, wherein after the second wave, just like the black fungus which you saw in adults, we have seen this condition called MISC. So each time you are tired, exhausted of taking the COVID appropriate behaviors, ask yourself if you would just like to push on just to avoid MISC in your child. I think this thought would probably bring you back to taking the due care, because the child will pick up only from the parents and they become transmission agents. I request now Dr. Nitesh Agarwal, who is also a neonatologist, to please tell us 2 questions, Dr. Nitesh, some from the chat box as well. One, we are seeing a lot of families getting affected. So how can the families handle themselves? Wherein the mother, father get fever, the second day, the child starts to develop sore throat and mild fever. One, how can they handle themselves? And the second, is it different in pregnant women, or is there some complication which happens in the newborn if the mother in the third or the second trimester gets COVID? Over to you.
Thank you, Sri Krishna. Firstly, thank you for giving me an opportunity to speak at this forum. The spectrum of the disease, I think both Sri Krishna and Sankoch Bhaskar sir have spoken extensively. So primarily, what we are going to see is a lot of minor infections, or rather a child presenting with a bit of a fever and cold cough. Now, in the current scenario, it's the anxiety which brings a parent to the hospital. On the day 1 of fever in a child, the child is at the hospital and the first question is, "Ye corona hai kya?" we would not be able to say whether it is corona or not. But in current scenario, we are actually taking every case that comes to the OP with a suspicion that this could actually be corona. So important thing is who brings corona to the home. It is obviously people who are actually exposing themselves to the outside. Children as small as infants, like few months old, are not going out. They are at home. So people who are working, people who are going out for different chores, they are actually exposing themselves. So firstly, please use mask, and that to a 3-ply surgical mask or a N95 mask for the people who are actually going out of home and then coming back for the entire duration of time that they are outside. That will obviously reduce the number of times the child or the small children may get infected. Now, when it comes to the management of children itself, I think Bhaskar sir has elucidated to the fact that this is a mild disease in most of the children. And the key to all viral infections is good hydration. So as long as we keep the kids having enough fluids, whether it be milk, fruit juice, soup, water, ORS, buttermilk, that is good enough. Now, the big question which generally comes up is the child is not taking enough food. He's kind of getting tired or he's complaining of body pain. You should still be encouraging the child to take some fluids. And the discomfort from fever, discomfort from cold cough should be managed symptomatically. This is what we as pediatricians would like to suggest. Paracetamol for high-grade fever where a child is irritable. The fever by itself is not a problem. It is the irritability, the child's unwillingness to cooperate, to have food, to have medicine, that causes a lot of disconcern among the family. So paracetamol can be given. And secondly, if there is a cold cough, simple medicines which will alleviate those symptoms will actually help a long way. Simple measures like steam, some nose drops, saline drops, these kind of things will be very commonly recommended by all of us. And again, we should, if in case a child is having a fever for 2 to 3 days, whether there is a family contact history or not, we are actually recommending doing a test so that the child does not become a super spreader. Now, coming to the specific question that Sri Krishna asked about the management of MIS-C. Now, again, I would say what we've so far talked about is the first step infection, where it is something which is manageable at home. And I would say in my practice, I would say 80 to 85%, almost 90% children are manageable at home. They do not even need hospital for anything. For the small percentage of children who are not feeding, or who are extremely miserable with vomitings, loose motions along with it, they may need admission for fluids. In such case, we may give them IV fluids in addition to the supportive management. And a very small percentage of children will get the MIS-C, which is basically our own body trying to, in a attempt to neutralize the virus, producing overzealous antibodies, and those antibodies causing harm to our own body, whether it be in the lungs, whether it be in the heart, whether it be in the other body organs. So again, there, obviously this child needs to be in the hospital, and generally it is in the second week or later, even third, fourth week, that this kind of a scenario may come up, wherein again a high-grade fever, sometimes inability or rather oxygenation being a problem, they need oxygen. And then in case we recommend doing heart 2D echo, that is obviously a child who is up to that stage will be in a hospital. So in the ICU for that matter, a heart scan will be done. Very small number of these children will end up needing some small dose of steroid. Occasionally, even some immunoglobulins have been used, but that is again the call of the treating team. Primarily, the steroid would probably be of role. But again, I would strongly recommend, if a child is having a reduction in oxygen level, which obviously we should be monitoring at home, or he's having very weakness, not wanting to feed, please take him to the hospital. There we will be able to decide whether he's got a pneumonia, whether he needs to be admitted for oxygen and IV fluid. And then if in case he shows evidence of MIS-C, then the steroid and other medications will come in. Now, the other part of the question was with pregnant women. Now, firstly, I would like to highlight that pregnancy is a time where our immunity is actually low. A lady's immune status is on the lower side when they are a pregnant lady's immune system is generally on the lower side. So again, that's the reason why we want these women to be extra cautious when it comes to using masks, not going to children who are already in home or family members who are actually having positivity with the COVID. Now, we in our first and second wave experience, a lot of premature deliveries have happened in women who've had COVID positivity. So obviously, it is important that even these women, they take care of their hydration, they take care of their symptomatic problems like fever, unwellness, those kind of things, the chances that the COVID by itself causing a birth defects and things like that are not much. There is not much evidence to say that kind of a thing. Okay, but it is the chance that prematurity is more possible because of any infection. It can happen. The same thing can happen with a COVID infection. Take extra caution when you are pregnant. Take extra caution to try and keep your hydration good. Take extra caution to not engage in a lot of physical activity when you are unwell with a COVID infection in pregnancy. So I guess that answers your question, Sri Krishna, about the pregnancy.
Yes. Thank you. Dr. Pavan, I'll just list out drugs. Tell me if there is a role and where to use it. Azithromycin, doxycycline, ivermectin. I know you have already clarified molnupiravir, oseltamivir. Are all these drugs used now? Secondly, what is the role of vitamin C, vitamin D, zinc, magnesium, multivitamin?
Say for COVID specific, none of the above what we used to take in medical college. See, you have to understand that usually vitamin C and zinc are prescribed for any cold. They're supposedly to improve your immunity against natural cold. So that is how they have come into the picture. But if you look at oseltamivir, this is for influenza. It works for influenza, not for COVID. It's an antiviral again. Ivermectin and other things, they're not going to be of much benefit here. The only thing what I'm again and again telling this, don't depend on major drugs, or drugs are not going to get you out of the system. What is going to get you out of the system is a simple wait and watch for the initial 3 to 5 days. If beyond 5 days you have persisting symptoms or worsening of symptoms, that's when you would go to the doctor. And doctors will decide on based upon each individual patient's profile, the treatment will change. If it is a high risk patient, there may be some role for giving antibodies. There may be a role for giving antivirals like remdesivir. There have been new studies saying remdesivir is better if you give 3-dose course so that progression is minimized. But these are for patients who have high comorbidities and higher risk of progression. Yes, if anybody in your family has had a severe COVID first time around, second time around, maybe it is worthwhile that you be a little more extra cautious because the genetic pool is that. Other than that, majority, like I said, all of us are going to go get the COVID this time. So there are very little exceptions who are not going to get COVID. So don't worry about it being a real downer. Yes, you have to be precautious. Once you have those kind of fever, you'll have a monitor of yourself, check yourself how your temperature is going up or not. If your symptoms are worsening, definitely seek out medical help. Otherwise, majority of the time it is going to be self-limiting. It will settle on its own. So don't be worried about what drugs, what medication. Don't go pestering your doctor to give you a particular type of medication, and don't read from WhatsApp and just take out everything else. So there are a lot of side effects from different drugs, a lot of effects from different drugs. Then you will be confusing about which one is causing the actual problem. So try to limit, take symptomatic treatment. Like for what you take for fever, take fever medication, paracetamol. For pediatrics, again, it all depends. So 3 days beyond, 5 days beyond fever, definitely seek out medical help. Other than that, I think nothing much. Don't overwhelm the system.
Yeah. So all these drugs don't have a role. In fact, the best drug which you can give is water. Water to sponge the body when the fever rises, and plenty of water. Hydration is in fact as important as paracetamol and all the other drugs. Each one of them probably has a role, and science is evolving and we'll know more about it. At this moment, it's only symptomatic. So if you have fever, paracetamol. If you have a sore throat, something to soothe the throat. If you have cough, maybe a cough suppressant. If it's mucus, a mucolytic. So leave that decision to the doctor. At home, please do not panic. Monitor your oxygen status, your condition. Stay in touch with the doctor. As I mentioned, the second week complications that usually happen, and we have seen it happen with Delta, are unlikely to happen with Omicron. 2 reasons. One, it can't bind so effectively with the lung cells and the blood cells. Second, vaccination gives you a very much subdued response from the second week. Therefore, it may not stop the transmission, but it definitely saves your life. Can we have Dr. Murari on for and Dr. Murari and also Dr. Bhaskar on for last set of questions. Now on vaccination, Dr. Murari, I know you're overseeing the entire vaccination program. First of all, the common question, and I've heard so many of my own family ask me, why did they still get this even after taking 2 doses? I know I've mentioned that it is not anti-virus. Vaccine is not antivirus. But is there any hope that we'll find a vaccine that will reduce even the community transmission?
So hope you are aware. We are all aware. It only decreases the transmissibility and the infection, which severity, the case fatality will be reduced after getting the 2 doses of vaccine, and this immunity will be boosted by taking even a booster dose. And recent guidelines have suggested not only 9 months you have to take the booster dose, even after crossing the 6 months from the last dose you can take the booster dose. This has also been implemented in our state. Now we are giving the vaccine after completion of the 6 months of taking the second dose of vaccine. So definitely we hope in the future we may get these more effective vaccines. The studies are ongoing. We are getting new variants, and we don't know how many new variants we will get in the near future also. It is continuous. It is a ssRNA micro virus. We don't know how it will get mutated, and we don't know how variants we are going to get in the upcoming future. So we
Thank you,
should be
Dr.
ready to
Murali.
face them.
So the best way to stop further mutation is to wear a mask. This
Wear a
way you're
mask.
stopping further transmission and also reducing it.
Wear a mask,
Nitesh,
well-fitted mask.
Yes, well-fitted N95 mask ideally in
Mask.
the current pandemic setting. Dr. Nitesh, quickly in just three suggestions for parents, because kids are back home, probably the online classes are resuming and physical classes coming down. How can they handle the stress of adolescents especially, and also the children who are now stuck to home all day?
The best way is parents becoming children once again. I guess the social interaction of children, the physical interaction with peers is completely lost. So the best way is parents kind of starting to give more time both for physical activity as well as going back to kind of playing with the children. And now a lot of things are happening online. And I think Bhaskar sir has told the big problems which we are facing apart from the development or psychological problems are the short-sightedness, and the second one is obesity. So again, physically that they are going to be challenging for us for the next few years. And when it comes to psychological disorders, a lot of adolescent anxiety and small children addiction to screens and all these things are causing a lot of havoc. So please, parents, please try and spend more time with children, involve them in board games, in physical games, and as well as interactive activities, rather than them just being stuck to their video games and their screens. Thank you.
Thank you, Dr. Nitesh. So it's actually an opportunity for parents to spend time with children. All these years you would have said, I was so busy, I couldn't do this, I couldn't spend time with them. Now is the time when all of you are at home. So please use this. Dr. Pawan, two quick questions. One, how accurate are the home testing kits, and can it also detect Omicron? Second, we are also seeing in this winter many of the seasonal diseases, including the flu. Is it possible for a patient or a non-medical person to distinguish whether it is flu or not in January, and also let's say in the coming months?
See, the first question, rapid antigen kits which are being used are basically devised not for home testing. Basically, they were used for cohorting a subset of patients and dividing whether they are COVID or non-COVID in a rapid fashion. So that, for example, if a patient comes with symptoms of COVID, you do that and then you divide them into where they go. They go into a COVID area or a non-COVID area so that the other patients do not get infected. Same way, they have been using it in different sorts in different countries for different purposes. Using it at a home, they're not so sensitive enough to pick up all the time. So majority of the time you may miss it. Sometimes there are faulty kits. A lot of people have asked me, there is no control line coming, but test line is positive. So these things happen. So it is not a foolproof method of detecting. If you think you have symptoms, and if your rapid antigen is positive, that does tell you that you have COVID. But if it is negative, don't be on the false assurance that it is negative. You may have to go and get your RT-PCR done, which is better test than your rapid antigen. Some countries have been using it at home testing so that you can isolate faster rather than going around and getting the infection to other people. So it is used basically as a screening test, not as a confirmatory test. On the second question is about, I believe,
Flu and COVID. Can we distinguish now?
It is difficult at this point of time.
In the couple of weeks ahead as well.
Yes. It is difficult, specifically even for hospital, even in the doctors community, it is difficult at this point of time to differentiate different viruses. Now we have been having, if the patient is sick enough, we have genetic tests. We are doing something like multiplex PCRs where we are picking up a lot of para-influenza, human para-influenza 1, 2, 3, 4. We are seeing those things in the community at this point of time. So they are around there. So there are multiple other viruses are also there, which are causing higher grade fever than actual COVID, and we are seeing them come with pneumonias, lung shadows, which are typical other viruses, which are not COVID. So it is a common thing that you will see other viruses also. If you have very high grade fever, things are not coming down. If your COVID report is negative, then it is definitely the other way around. But sometimes you may have cough. Rhinitis is very rare in running nose. A lot of running nose is very less in COVID. If you have a lot of running nose, usually you might think that it is other non-COVID virus. But you should not ignore if your symptoms are persisting beyond. That is what I'm saying. If it is more than 3 days and symptoms are persisting, seek out medical help. It could be some other virus. It could be some other infection. It could be other.
Yeah, and in the current pandemic scenario, any throat infection or anything that causes fever for you, please consider strongly to be COVID until proven otherwise, because that allows you to isolate yourself. The difference between the flu and the COVID, as per Government of India recommendations, currently 7 days of home isolation and symptomatic treatment. Whereas for flu, it's likely that after 3-4 days you feel better, and then you become a spreader for your family and also friends and others. So important to get tested and consider currently every symptom to be probably COVID, and let the doctor take a call on what it is. Even for them, it is very difficult. So leave that decision to them. Dr. Bhaskar sir, last question on the vaccines. There's a lot of apprehension, and I know some of the learned people also now have a lot of fears, and somehow that trust which the vaccine had, especially after the second wave, is slowly getting into a phase of doubt. One, do you still advise people to go for booster, because it's now open for health workers and probably for general public in the months to come? Secondly, do you still think the vaccine would be able to stop deaths? Because there is a lot of fear that the virus will continue to mutate. So what really do you see is the role of the vaccine?
Rightly said. Am I
Yes, sir. You're audible now. Go ahead.
Definitely the vaccine is very less in India, and no vaccine is protects about 0%. The intention of vaccine is to prevent disease, particularly severe form. So, coming to the point, strongly advise all the health group of frontline health person to go for reinforcement. That's what we call it. And if possible, every person about 2 years vaccines. This is, and our present are giving good, and they are not allowing the to get probably asymptomatic. So they can, and the reinforcement for frontline health. Thank you.
Thank you. So if I can just sum up the key take-home points. One, the current Omicron variant, I would suggest not to consider it mild. What is mild to you might be really tough for others to bear. So call it as non-fatal for now, at least it's not resulting in extensive hospitalizations and deaths as of now. But if you have comorbid conditions, please be extra careful. The presenting symptoms, you can't distinguish it from the common cold or the flu. If you have any symptom suggestive of a respiratory infection or fever in the current pandemic scenario, it is probably COVID. Please get yourself evaluated. Leave that decision to the doctor. Please isolate yourself as soon as you have symptoms. It is likely that you will have milder symptoms, mild in the sense it doesn't affect the lower respiratory tract because the receptors are not adequately primed to the current variant, and the vaccine probably, if you have taken 2 doses, will protect you against the serious hospitalizations. The disease may last for about 3 to 4 days, wherein you have common symptoms like fatigue, weakness, fever, less of rhinitis, less of running nose. But after the 4th, 5th day, you tend to feel better. The second week complications, which we saw with Delta, we presume it is lesser. But in circulation, you don't know if the one which you have is Delta or Omicron. So please keep yourself under strict monitoring for 10 days. In children, the presentation will be same like an adult, upper respiratory presentation, but more likely it will be very mild. May have high-grade fevers. Do not mistake high-grade fevers for something else. Viral fevers do tend to have high-grade fevers at the onset. The wonder drug, the magic drug is water. Make sure along with paracetamol and the symptomatic treatment, you hydrate the child and also yourself very well. Any family wherein more than one person is affected is probably COVID until proven otherwise. You can't have any other explanation in the current scenario. Watch out for complications in children. Don't panic about the admission and the need for oxygen. At least we have not seen it as yet. But please keep a watch. Each time you feel you're tired, exhausted, remind yourself that this is not over as yet. And it's all in your mind. If you are able to wear a mask and stick to the mask, you are able to fight it. Dr. Pawan said 80-90% will get affected. There's still 10% who will not get it. No reason why you should not be in that 10%. All it takes is just sustained effort on a daily basis. You have done it in so many things in your career, in your personal life, in your studies. Now it's a challenge for you to stick to COVID appropriate behaviors. This will really help you and also your children. In terms of management, it's only symptomatic. No role of doxy, azithromycin, all those drugs which you have heard of, no role. Molnupiravir, yes, only in research settings, but it causes issues in conception, teratogenic in nature in some studies. So don't take those calls. Antibody cocktail only in specific conditions in unvaccinated. So please do not read too much into this. As I said, the main drug is water and symptomatic treatment. When you have to hospitalize yourself, when you have danger signs, high-grade fever beyond day 5, you're breathing too fast, your SpO2 levels are coming down, and you have comorbid conditions, and you're feeling too lethargic after day 5, that is when you have to reach out to a doctor. Vaccine saves life. There is no doubt about it. It was never meant to stop virus. Vaccine is not meant to kill the virus. Please don't have that assumption and keep wondering why you should still take it. You take it so that you save yourselves and also your loved ones. So please take the precaution dose. It's called as a precaution dose as of now. So take it whenever you're due. 9 months is the ideal period. Which vaccine will be more effective? Should I mix and match? All that is all theoretical and hypothetical. What you get is what you have already taken last time, the 2 doses. The government will not allow you to take anything else. So don't worry into all that. What works is the mask. A good N95, good fitting mask. Doesn't matter how long you keep it. What matters is how much time did you take it off and where did you take it off? What time did you take it off? So focus on COVID appropriate behaviors. Please take your vaccine whenever it is due for you and continue COVID appropriate behaviors even after you take vaccine. Thank you so much. And I think we've covered most of the questions, even those coming from the chat box. And thank you, esteemed panelists, Dr. Murari, Dr. Sankoch Bhaskar, Dr. Nitesh Agarwal, and Dr. Pawan Reddy. Thank you so much for answering all the queries. And I hope we've been able to make a little change in everyone's behavior, and wishing you all good health and hope you all stay safe. Thank you, and over to Pratyusha.
So thanks a lot, Dr. Sri Krishna. I think that was very, very informative, very useful. And I would say that these are very genuine tips which each one of us can take it back. And I know we've answered many questions. I would like to thank Indian Academy of Pediatrics, the Twin Cities, Dr. Sri Krishna, Dr. Nitesh, Dr. Sunkoj Bhaskar, Dr. Murari, and Dr. Pavan, who made their time to be able to give their valuable wisdom and information to all of us today. So on behalf of SESC and Indian Academy of Pediatrics, I would like to wish everyone a happy Shankranti, a happy New Year. Please stay safe and looking forward for a bright year and wishing you good luck. Thank you.